Hello, this is the fifth lecture on sexuality, and I'd like to take this material beyond the David Scharf text and summarize as best I can a field that's so rich, so broad, so important that I don't know any clinician or any theoretician who knows where to start. This is the subject of sexuality is just too big. It's too tied to our identity, too tied to our development. So please forgive me if I go down a road you wouldn't go down. I don't know any two clinicians who are asked to talk about sexuality who end up talking about much the same thing. So this is my take on how we think about sexuality now. I will address the Diagnostic and Statistical Manual 5 and its slightly modified approach to dysfunctions and the paraphilias, what used to be called perversions. But by and large, I want to initially begin with a discussion of what sexuality is in a larger sense. And I think it will not do to continue to discuss sexuality as if discussing it in the context of our own culture is the only way to do it. One of the most important quotes I've ever read on the subject comes from Freud. And he juxtaposes the ancient Greeks with our modern approach to sexuality. And here's what he says. Follow this along if you can. It's so revolutionary. And at the time, I think it was so revolutionary, I'm not sure anyone really understood it. It may have taken 110 plus years for us to really begin to grasp what he meant. Here's the quote. The most striking distinction between the erotic life of antiquity and our own, no doubt, lies in the fact that the ancients laid stress upon the instinct itself, whereas we emphasize its object. The ancients glorified the instinct and were prepared on its account to honor even an inferior object, while we despise the instinctual activity in itself and find excuse for it only in the merits of the object. What does that mean? And the reason it's hard to discern is because its meaning is so shocking for most of us in the modern world. We only think of sexuality the way we think of sexuality. And what he's postulating here is a way that's radically different, so radical it doesn't make sense. We don't see what we don't expect to see. We don't see difference in a way here. What he's saying is that in our long-term Judeo-Christian culture, sexuality has, by and large, been despised. The body has always been a temptation. Sexuality has always been a sin. And it's only justified in the quality of the loved object, the pursued woman, the heroic man. Only then is the messy business of sexuality even tolerated. The Greeks, he understood, and he was a fair anthropologist and historian in his own right, the Greeks understood it very differently. They privileged the instinct. They privileged the sex and saw it as what was to be sought after. And the object of their desire could be less than ideal. It was the desire that they were facilitating the achievement of. And what I want to keep in mind with this amazing quote from 1905 is that we have to be careful that any discussion of sexuality doesn't get wrapped up in our cultural prejudices, even our modern ones. And I think we are in just as grave a danger today of being blinded by political ideology as Freud's contemporary Victorians were blinded by their contemporary rigid moralistic ideology. I think we're doing today the same thing on the other side. So if it's true that there are more ways of achieving a healthy, appropriate sexuality than perhaps Freud initially thought, and he's the one that opened us up to the possibility of other ways of thinking about sexuality. If it's true that sexuality as a peak developmental achievement of the highest specimens of healthy sexuality as being coextensive with genital complete development, what happens if that's not entirely correct? And Heinz Lichtenstein, in two of his articles, starts with that quote from Freud about the distinction between the erotic life of antiquity and our own, and then quickly asks the question, well, wait a minute, ecstasy, the feeling of intense pleasure at orgasm, male and female, doesn't that serve a function above and beyond simply a reward for the difficult work of development? And he notices something all clinicians have noticed, and frankly, most of us have noticed, in this next paragraph. What is particularly difficult to reconcile with the classical concepts of psychosexual development, from orality to full sexual maturity, is and what he means by that is the privileging of genital sexuality and achieving a mutual orgasm as the pinnacle of both psychic health and sexual development. As if you can't have good sex unless you're at the top of the psychosexual development pile, is the fact that the experience of ecstasy does not show an invariant correlationship to the capacity for stable object relations. In fact, it often seems to contradict the concept of the utopia of genitality, in that ecstasy might be found under conditions where, to use Freud's words, quote, the nature and importance of the sexual object recedes into the background. Under such circumstances, we may even observe the glorification of the sexual drive itself in a manner similar to that which Freud found characteristic of the erotic life of antiquity. The phenomenon of ecstasy without stable object relations is, of course, well known to psychoanalytic observation. It is usually conceptualized in terms of infantile fixations, regression, narcissism, in short, as a vicissitude of a deviant psychosexual development. Now that's a lot of technical jargon, but it boils down fairly simply. If it isn't true that only healthy types can achieve this ecstasy of sexual release, if we see enough examples of people who are frankly not particularly sexually or emotionally developed, describing and having sexual connections where they appear to be erotically, intensely pleasured, and yet themselves aren't emotionally integrated in a way consistent with our traditional theory of psychosexual development, then we have to reevaluate what sexuality means. And this may be inappropriate, but I had a student a long time ago in a class where I was giving a lecture on sexuality, and he wanted a little more nuts and bolts information. This was his first attempt at college. He was in an automotive training program, and psychology was a mandatory class. And I was talking about sexuality, and he raised his hand and he said, "Hey, Mr. Bigelow, how come it is that only the crazy women are good in bed?" And everyone laughed, and I sort of chuckled, and I thought about it for a minute, and I hung my head, and I shook it, and I said, "I don't know." And we all had a good laugh out of it. And what struck me years later is when I read Freud's quote and Lichtenstein's great article, was I think that young man, naive and uneducated as he was pointing to the exact same idea that Lichtenstein and all of his amazing research had noticed. And he was asking the same question. And the answer seems to me to lie in Lichtenstein's treatment of a broader function of sexuality than we have previously given credit for. And I'm going to be careful here. I'm not going to go down a social constructivist vision of sexuality. I'm going to stay grounded in that golden mean of Aristotle. I don't think we need to give very much credence to the rigid moralists of the Victorian era or their current counterparts that despise sexuality on moral grounds. But I don't think we have to, therefore, grant to the social constructivists a plastic sexuality that knows no boundaries, that is completely okay with whatever feels good, do it, that no one can judge anyone else's sexuality. That's just insane. There are boundaries, there are grounded realities in psychosexual development, in object relational development, in the reality of the human body that is limited by its genetic evolved dynamics, We must have boundaries and we must have limits. And as much as that offends our infantile grandiosity, as much as we reject and resist the sort of moral neuroses of those that deny and disparage sexuality on metaphysical grounds, as much as those who wish to throw open the doors and do whatever they want and let that be okay and demand that we sanction whatever their personal idiosyncratic sexuality is, that we be, in the words of one university counseling center leader, sex positive no matter what, seems to me to be as pathological as the old moralists. So so navigating that is tremendously difficult and complicated. And I start from Freud and Lichtenstein's idea that sexuality is much more than we used to think it was. And we need to be able to understand how it is that ecstasy in a sexual connection can have such a profound effect on us, simultaneously by being careful that it not be the result of pathology or a disrupted object relational constellation internally. We also, being open-minded in that vein, have to be careful of the other edge of the continent. We can't drop off either end. Okay, so with that as bedrock, we have to go back and recognize some trends over the last several decades in psychoanalytic psychology. And the trend that seems most obvious to me is simply this. André Green, the great French psychoanalyst, wrote in 1995 an article that I think is rightly famous. Has sexuality anything to do with psychoanalysis? And if you're not familiar with the history of psychoanalytic theory, you would think he was asking a straight question, but he's not. This is somewhere between irony and sarcasm. For the first 50 years of psychoanalytic theorizing and psychoanalytic therapy, psychosexual development, the phrase coined by Freud in 1905 or so, was the core of the work, of the thinking. We were sexual creatures from head to toe. There wasn't any other drive in us. Freud didn't even add aggression to his metapsychology till he was in his early 70s. For the original 50 years of psychology, it was all grounded in sexuality. There was little else but sexuality and its derivatives to talk about in psychoanalytic thinking and therapy. From Melanie Klein on, and a variety of other thinkers, it is clear in the last 50, 60 years that the subject of sexuality has completely lost its primacy in psychoanalytic theory. It remains important, but it perhaps at best now can be seen as the first among equals. It seems that that's a mistake. It's a problem now. That Freud was probably right about the primacy of sexuality, and we have lost something of the therapeutic power that Freud achieved with a theory that was grounded in human nature, that was a theory grounded in evolution and biology in a way much more than our current social constructivist theories, which are anything but grounded in biology. We have become unmoored from biology, and the answer to André Green's question, or implied question, is that we have simultaneously become unmoored from a grounding in sexuality. That, I think, is what has unleashed the social constructivists, the ones who think that plastic sexuality is the way to go, the groups and organizations and individuals who think that sexuality is entirely plastic and there are no bounds but our imagination to what can be appropriately done to ourselves or to each other. Now, this has broad social consequences. This has to do, and I don't think I'm exaggerating this in the slightest. This has to do with the question of our identity as human beings and the bedrock of our culture. Who are we as human beings? It will result directly in radical changes in the nature of our culture if we, on the one hand, accept that we are biological creatures with limits who have to adjust to reality, or if we are creatures who think we can form ourselves in any way we want to, that we are a blank slate upon which education can change us in any way we want, regardless of reality or biology, the direct derivative of that are radically different social organizations. What we see now as we switch from one to the other is the unraveling of the identity of our cultural bedrock. We no longer know what it means to be a man and a woman. We no longer know what it means to be, for example, an American. That used to be obvious and accepted. And when people came to this country, they assimilated into an American identity. Now that's all been attacked mercilessly for the last 50 years, and the result has been a undermining of the very definition of what it means to be an American. We don't believe anything like we used to believe anymore, and what is happening is that the fabric of civilization appears to be unraveling. Maybe I'm getting too far away from the question of sexuality, but I think not. Sexuality is this important. And the derivatives of what was at once perhaps a bit of a theoretical, arcane, meta-psychological dispute or discussion is seeming now, if we look around, to have immediate impact all around us. This is a question of the rise and fall of Western civilization. This is a question of the rise and fall of our identity as citizens of this country, and our identity as men and women in relation to each other. And perhaps the most important thing, this calls into question, this disruption of sexual theory calls into question the very nature of our own identity at, and I don't think I'm exaggerating here either, at the question of sort of existential being. If we don't know who we are sexually, how do we know who we are at all? And if we don't know who we are, what do we do? What is the right course of action? How do we raise our children? How do we relate to each other? How do we have sex or not? If these questions aren't understood in some consistent way, they appear now to be consistently sort of fragmenting. So I don't have any illusions that anything I say or do is going to change anything in the rise and fall of Western civilization. What I'm hoping is at the very least I can myself come to some understanding of what this means to me, and if I have even the slightest ability to help others struggle with these issues themselves, that appears to me to be the point of the exercise. Maybe that's all we can hope for. I am not a utopian. Freud at the end of his life was quite cynical and not very hopeful about the power that psychoanalysis might have to change much of anything. I feel his pain as I struggle with this stuff. I try to maintain a hopeful outlook, but this material is so large and so difficult that I guess I'm just stuck with saying it's going to make a difference in my life and my family and my friends, and every once in a while maybe my students and hopefully my patients. And frankly, I'm not responsible for anything beyond that, and that's enough, and I think that's a lot. And so without becoming cynical myself and without giving up, because that won't do, what I'm doing here is attempting to provide a way to think about living, loving, enjoying life, becoming stronger, becoming better, for situating sexuality in our lives in a way that both reflects the reality of our evolved biology and the most we can hope for in a society that seems to be changing around us rather quickly. I have several references that I want to present that I think do that better than I ever could with my brief summaries. The first is from Robert Caper, Dr. Robert Caper's great text, A Mind of One's Own, A Mind of One's Own. I think this is absolutely foundational, and I ask your patience when I have a rather large quote. I think it's obvious, worth getting word for word. And here he is on sexuality. Reality testing is connected to the state of one's internal sexual parents and one's relationship to them. The precise state of one's internal sexual parents, i.e. the degree to which one has been able to accept an internal parental couple whose sexuality is pleasurable, creative, and non-destructive, plays an important role in one's ability to establish the kind of playful, experimental relationship to reality that I have been describing as well. That's a perfect summary, a beautiful, poetic almost summary of the need to have parents who themselves are healthy in order to provide the child with the model of healthy sexual relating. He goes on, what I mean by this is that an ego that is normally linked to reality, i.e. that is able to observe reality, to allow one's wishes to become subject to reality, and to learn from experience, is like a mother linked sexually to a father in a pleasurable and creative way. Such an ego is capable of allowing itself to be penetrated by reality and to thrive and to grow from the penetration rather than feel humiliated by it. Oh my God, this is again a poetic rendering of the direct impact of the parental internalized loving couple inside the mind of the now adult child, who is himself or herself attempting to create that loving relationship with another. There's a direct correlation to the mind of the adult who has in him or herself the loving, penetrating couple. It's a metaphor, but it's almost a direct representation. If I'm going to be a scientist penetrating reality, I have to have that sexualized dynamic inside me. If I'm going to allow myself to be affected by the world, to take in, to be penetrated by reality, I have to have the internal experience of the loving couple inside me. This is the core of Freud's idea of the innate bisexuality of man and woman. We have what Freud called a normal amount of bisexuality within us. This is how I believe it manifests itself, that we take in the loving couple. That means a man has a mother inside him. A woman has a father inside her. He takes in, hopefully, the combined parental object in a loving, non-destructive coupling. That means he has a woman inside him capable of being penetrated, integrated into his psychic structure. She has a male, aggressive, penetrating, and capable of being integrated into her psychic structure. We both genders have this dynamic in us if we are healthy. If we did not take in that penetrating and penetrated loving couple, we remain hateful, hurtful, suspicious, fearful of hostility, fearful of our own aggression projected out onto the other, incapable of calm and nurturing joy in intimate sexuality. Beautifully written theoretical summary. He goes on, at the same time, the capacity to experiment with nature, to probe it with questions and projections, requires one to be able to actively penetrate one's objects without feeling that one is committing a destructive invasion. That is, one must be able to have an internal sexual father whose activity is a helpful penetration, not a destructive one. Both of these capacities, the capacity to receive observation and the capacity for active inquiry and experimentation, are therefore equivalent to a third, the capacity to conceive of sexual intercourse as an activity between two people that is mutually beneficial. That's the internalized loving couple. That is why in the last lecture and one a long time ago, I said that parents can't be good parents if they don't have a good sex life. What's being transmitted to the child is this loving couple, male and female objects inside, which then can use that fantasy of penetration and being penetrated in good and loving and productive ways to move out into the world, to explore, to penetrate, to be able to take in reality and others and knowledge. This is why the resolution of the Oedipus complex is so central to human survival and health. It is the resolution of the Oedipus complex that provides that internalized loving couple. That is the nature of its resolution. That is why people who have not been able to make that transition, who have not resolved, who have not taken in the loving couple, inevitably have relational troubles themselves, sexual troubles themselves, and I believe what we now call learning disorders, cognitive disorders, are really not anything like neurological dysfunction. They are entirely like anxiety disorders with an internalized, too much internalized hostility, fragmented individual male and female objects that come in and cannot interact, penetrate, be penetrated by knowledge and the world. And they, out of anxiety, displace, dismiss, deny, not able to concentrate. There is directly a connection between the resolution of the Oedipus complex and learning disorders, ADHD, and I think as well the newly understood autistic spectrum disorders. These are all connected in a way I don't think is understood adequately. Understanding it this way provides us a direct route to healing and health. He goes on. The ability to learn from experience is therefore connected to the state of one's internal combined parents, meaning the unconscious fantasies that one has about their intercourse. I've never read a more direct connection between the internalized copulating couple, if I could use that phrase. It sounds so absurd. It sounds mildly obscene. It sounds ridiculous in some ways. And yet, if we can take that in somehow, then we have some ability to learn from experience. The whole idea of learning from experience has been pitched as some sort of external thing. We learn from the doing out there. That isn't true. Things happen to us out there all the time. The question of learning is an internal question. Can we take in the experience? Can we allow it to add to us to the sum total of our emotional, intellectual internalizations, identifications? Can we take it in? Can we allow ourselves to be penetrated by it? Only, he says here, if we have experienced parental, sexual, psychological, emotional dynamics. Not if we've seen our parents having sex. That's not what he's saying. It's not anything like what he's saying. That's never what Freud said. He said, in fact, that children allowed to actually observe parental sexual dynamics virtually always damage their children. And I think he's right about that. Remember, please remember that this is about the sexual couple's fantasy life, sexualized emotional dynamic back and forth. Nothing here about exposing children to anything actual in terms of sexual physical contact. He says, what seems to be crucial in this picture of a mutually beneficial intercourse is the feeling that the parents retain a mutual autonomy from one another in the process. This is central. This is central. One does not feel that either parent is taking over, invading, merging with, swallowing up, or otherwise destroying the identity of the other. This is equivalent to a feeling that we may probe our object minds without destroying them, and that we may be receptive to our object's projection without being destroyed ourselves. This is a mature understanding of sexual life. Children, when they first get exposed or first have a fantasy of sexuality, inevitably understand it as a destructive, painful, violent thing. If you ask a child the first time, ask a child this, they hear some noise from the bedroom. Inevitably, their first fantasy is that mommy is being hurt by daddy somehow, that there's this violence, and that reflects the aggression in them as much as anything else. And so it takes some time. It takes the internalization of much loving object relatedness for adults to be able to experience sexuality in a way that does not have too much of a component of aggression. And if you can do that, then what Dr. Caper is suggesting here is that it opens up the entire world. That only if, matter of fact, it's the opposite. If you can't do that, then the world is effectively foreclosed to you. a real understanding of the world, a real acceptance of the world as it is, the ability to deal with reality in effective, adaptive ways, is entirely, virtually, dependent on the resolution of this Oedipal dynamic that Freud laid down in 1905. At the same time, Capper goes on, the child must recognize the parent's sexual relationship as a fact that is autonomous of its wishes. One of the benefits of resolution of the Oedipus complex is that it establishes in the child's mind the parent's sexuality as an autonomous fact, and this leaves behind a salubrious decrease in the child's omnipotence. One realizes the difference between one's real place in the world and one's wished-for place. If the Oedipus complex is not adequately resolved, belief in omnipotence remains too great and the ego will not be able to experiment with reality, since it will then feel that its fantasies are too powerful to play with safely. This leads to the somewhat surprising conclusion that if the sexual autonomy of the parents cannot be accepted, what is subverted is ultimately the autonomy of one's own ego in its playful and experimental link to reality. Oh my goodness. What he's saying here is that much of today's unraveling of our cultural fabric seems to be due to the catastrophic failure of the family's current ability to bring this resolution to the children's developmental capacities. That we are in denial of reality because we have not been able to internalize the reality of our parents' sexuality as a good thing separate from us. That we wish to maintain oneness with the mother. We cannot in reality, and that resolution, that acceptance of reality sets our ability up to deal with reality later. Failure to do that precludes to that extent our ability to learn from experience in the real world. Every learning disorder is affected by this. Every adult mental illness is affected by this. Every adult's inability to form a mutually loving sexual human intimate connection has its genesis in this failure, the failure to take in a loving, penetrating couple and to accept the reality that the child's needs do not include omnipotent control and connection with either parent. That difficult and painful bit of reality, assisted by the parents in a loving family dynamic, assisting the child to work through that conflict, that difficulty, that frustration. This is really where the terrible 2s and 3s come from. This is the source of childhood disruptive behavior because what we're asking the child to do is terribly, terribly painful for the child. If we don't understand that, we can't help them. If we don't diagnose the problem correctly, we have no solution that works in the psychic reality of the child. Seen in this light, normal play, a normal sexual life, and normal intellectual functioning all require a capacity for a certain type of playful or experimental, projective and introjective link to one's objects. We would therefore expect a disturbance in any one to be associated with disturbances in the other two. This is Dr. Capper linking object relational development to sexual and emotional dysfunction in adolescent and adult lives. It also, I think, provides us the bridge. It provides us for the diagnostic capacity to see what the problem really is. And folks, I don't know if you disagree or you agree with this theory. What I'm suggesting is, I don't know if it's true or not. I'm not pitching this as if it's true. What I'm pitching it as is the unquestionably most useful way of thinking about human development, sexual development, and character development. Using these ideas, therapists have been able to help patients get stronger, get better, and live their lives in some joy and peace. And so I am willing to put all this aside if someone will give me a better theory. And I am mimicking Freud here in not claiming some metaphysical truth to this. But I am saying, and I think the clinical data supports it, that this way of thinking about human sexual development provides us with tools that will allow us, better than any that currently exist, to provide help for people in trouble, to provide help for families that are disintegrating, to provide help for individuals whose psychic reality never was solidified adequately. I have seen this in my clinical practice over and over. Good therapeutic work using these ideas results over the course of time and a lot of hard work in the transformation of character into loving, healthy, productive, creative individuals, sexually rich, artistically, aesthetically, productively rich lives of intimate connection, sexual connection that provides the basis for the next generation's health and happiness. It's an amazing opportunity here if we can tolerate how threatening it is to our preconceived notions. I've already established, I think, the primacy of the Oedipus complex adequately. I want to talk for a minute about what happens when it goes wrong more specifically. There's a text called The Addictive, or just Addictive States of Mind. It's edited by Bauer, Hale, and Wood, the Tavistock Clinic series. And in it, there's a one-paragraph discussion of the psychoanalytic understanding of perversion. Now, if I've been talking for a long time about how to get it right, about what a good sexual life is supposed to look like, I do feel obligated to describe, in accordance with the most recent clinical material out of the Diagnostic and Statistical Manual 5, I do need to spend some time looking at what and how it looks like when it goes wrong. So I'm going to use the word perversion here, and frankly, again, it's falling out of favor as a word. It seems to be tied in modern parlance to the old moral, judgmental way of thinking about behavior. That's not how psychoanalytic thinkers characterize it. Here's how they characterize it. Psychoanalytic definitions of perversions vary, but a recurrent theme is that perverse behaviors are distinguished by the use of sexualization as a defense to manage anxiety, particularly those anxieties that are aroused in intimate relationships. And there's a list of them here, such as anxieties about loss of control and castration, anxieties raised in confrontation with the facts of life, such as generational and gender difference, or claustro-agoraphobic anxieties about the loss of self or abandonment. Central to most theories of perversion is the notion that what is sexualized is aggression, so that the perversion represents a fusion of sexual and aggressive forces. Thus, a behavior ostensibly concerned with sexual expression is primarily driven by aggression rather than libido. The psychoanalytic notion of perversion, therefore, encompasses behaviors that might seem culturally acceptable and non-paraphilic, such as repeated casual sexual liaisons or the use of legal pornography, which may nevertheless serve a perverse, quote-unquote, function within the mind. Now that sets up the stage here, I think, and pushes us to the edge of a discussion of what's healthy and what's not. The Diagnostic Manual has a series of sexual dysfunctions, behaviors that, with certain emotional or behavioral symptoms attached to them, may be classified as a sexual dysfunction. They also have a separate category of paraphilias, what used to be called perversions, and they are classified differently, primarily, I think, because of this connection to aggression. Now, I got this a little technical here, so bear with me. It seems that the management of anxiety in ways that derail sexual development can result in a sexual dysfunction. The management of aggression, and I will include ideas of hatred and hostility and violence, combined with sexuality, result in the perversions or the paraphilias. I'm going to try to make some sense of this, and I think, again, I don't know if this is true in some metaphysical way, but it's been useful theoretically to divvy these things up in a little bit and try to make sense of some of these sometimes shocking categories that offend us, categories that evoke in us almost a visceral sense of disgust and horror. We do not like to think about these things. frankly, one of the ways that we can think about them is we have some nice, neat categories that can help put these things in some kind of structure that allows us to contain our own anxieties that are inevitably evoked by the very discussion of these things. Okay, so there are some variations between this and the DSM, but they're relatively minor. Between the DSM-4 and 5, there are very few differences of any importance. One or two minor categories has been renamed, one or two has been dropped or renamed something else. But by and large, this sort of general structure has been maintained. Now I want to go back a little bit. So before I go further, let me show the camera the chart that I drew up, and I've been writing on it because it's a work in progress and I don't ever expect it to be perfectly aligned. So here we have on the far left, normal in quotes, bisexual down below it, and homosexual and heterosexual. In the middle we have the sexual dysfunctions, and on the right we have the perversions. I should have put paraphilias there. So I will list these in order, and I want everybody to understand how the DSM divvies these up and what some of the key determinants of a mental illness that one would class as a sexual dysfunction or a perversion. And I'll try to tie them together in ways that make sense using this idea of anxiety management versus the management of violence or hatred, aggression, and that sort of thing. Okay, so step one, normal in quotes. What is normal? One of the things that's not normal is assuming that everything you like is normal. Normal ought to have a little broader objective standard than, if I like it, it's cool. If I think it's gross, then it's a perversion. I hear that all the time. Ooh, gross, that's sick, that's perverted. Well, maybe, maybe not, but your personal subjective opinion about it doesn't hold much water. It may or may not, but that depends on your sexual development and your sexual dynamics internally. So we got to be careful here throwing words like normal around. In Freud's day, homosexuality was a perversion. Homosexuality was a crime and was in Europe till very late and was even in America till very late in the day. Freud believed that bisexuality was normal. Now, I got to be careful here because the research is clear that people who overtly act bisexual in some indiscriminate way or have the ability to have sex with both men and women, the literature is unmistakable. Those folks are consistently suffering from severe mental illnesses, often at the borderline level of ego structure, and could be classed frequently, if not regularly, if not in the overwhelming majority of cases, as having a severe personality disorder or at least dysfunction. That's not what Freud did not mean that we all could have sex with men or women indiscriminately just fine. That's not what he meant at all. He meant this object relational dynamic, this internalized mother and father that provide us with a basis of experiencing and reacting to penetration and to penetrating in ways that evoke in us the male and the female. It sounds a little esoteric or a little theoretical, but I got to be clear that Freud's understanding of normal bisexuality does not mean that we can indiscriminately go out and do with whatever we want with whoever we want. That is not the case in Freud's thinking, and it isn't the case now. I think I said before that since 1972, at least, going back to Freud's 1905 3 essays on sexuality, heterosexuality and homosexuality are now seen as two developmental tracks that in and of themselves imply no automatic mental health or automatic mental illness. That's the standard that we have now. That is the accepted psychological version. There are religious groups left and right that disagree with that. There are conservative Orthodox Jews. There are all Muslims that I'm aware of disagree with that, and most conservative Christians disagree with that rather violently sometimes. People around the world today, mostly in Muslim countries, are still being executed for being homosexuals. We don't do that here, and that's a discussion beyond the scope of this lecture. But that's what we would consider normal now, in quotes. And okay, Normal implies a healthy, integrated, whole, object relational psychic structure. It doesn't imply a thing that you do. Here's the biggest and most important distinction between the modern psychoanalytic understanding of mental illness around sexual issues, is that it's the thing. It's not the thing, it's the meaning of the thing. It's not the physical behavioral act of sex in however you do it that makes it a dysfunction or a perversion. It's the unconscious meaning of that thing in the context of your psychic unconscious structure. And however, there are limits to that. There are certain things that you do, and it doesn't matter what your subjective experience of them is. They are perverse or paraphilias or hurtful, destructive, often criminal and dangerous, and the doing of them cannot in any meaningful way be authorized or approved or thought of as normal or allowed in some multicultural and diverse world to be subjectively okay. Rape is rape. Rape is a sexual dysfunction as well as a heinous crime. And one is on impossible ground, claiming somehow that you could argue it's just a function of that person's unique and developmental sexual expression, and we would be crude and primitive and Victorian if we somehow criticize someone for such a subjective experience of their sexuality. That ought to appear absurd on its face. Well, if that appears absurd on its face, we just have to back that up a little bit, and now we get into kind of a gray ground. The sexual dysfunctions in the DSM entail a dozen or so acts, behaviors, and each has a checklist of emotional or other behavioral subcategories that has to be calculated, looked at, checked off. And if you have 4 out of 6, then you can be put in that category. If you have 5 out of 7 of the other, you might be put in that category. Nothing says you can't be in more than one category at once. Frequently, they call it comorbidity. That's the norm in this field, not the exception. So we have dysfunction. Your sexuality just doesn't work. You can't get an erection. You have inadequate vaginal lubrication. You, for a variety of reasons, do not perform the sexual act adequately. I would throw in androgyny here. You do not quite clearly enough recognize yourself as either a man or a woman, and there's some confusion about that. There's quite a long category involving desire disorders, aversion disorders, oral or erectile disorders, orgasmic penetration, premature ejaculation, or pain disorders involving both men and women. If you have any of those and you meet the other criteria in the category, you can be diagnosed. Transvestic fetishism, usually men, sometimes rarely women, dressing in women's clothing and getting an erotic reaction from it, remains a sexual dysfunction. Gender identity disorder now is called gender dysphoria, and there's a whole list of technical names now that go along with that. It remains a sexual dysfunction, and I think that makes sense. Although the categories has been, one of the key elements of that has shifted rather substantially. I may come back to that. Bisexuality, and 2 or 3 other categories here. Pornography, addiction, sexual addiction, and or promiscuity, and the acts of prostitutes or their johns, those that serve as prostitutes. Are those last 3 or 4, are they appropriately in the category of sexual dysfunction? I think the answer can be yes, if that underlying question gets asked. The question that you have to ask in all the rest of these is the person's functional sexual experience about managing unconscious anxiety around the sexual dynamic. If that's the primary dynamic, then what we have here is a dysfunction. If you don't function sexually because the sexual experience was taken in by you as a child, with so much anger, so much fear, so much frustration in the household environment, and that you have associated sexuality with pain and anxiety, and you don't function because of that, then you're in a dysfunction. If it has that direct anxiety management, defensive function, and it just happens to be manifesting because of your unique developmental trajectory in one of these ways, or any of these ways, then you're going to be in the context of sexual dysfunction. And how you do that is often quite uniquely related to your personal history. But I think that's a way, if you don't think of it that way, it all seems quite chaotic. Underneath all of these dysfunctions, there appears to be the management of anxiety centered around the child's developmental taking in of the parent's sexuality, and in addition to that, the parent's emotional context in the child's relational dynamic, which may itself be, and this is the important part, it may not just be the parent's deformed sexuality causing the child's deformed sexuality. The child's sexuality can be derailed for other reasons of anxiety than the parents. I think the parents have to have a healthy sexuality to have a healthy child, but it's not enough. They may have other issues, other things may have happened, and that may translate into the child's developing anxiety around their own sexual development, resulting in any of the sexual dysfunctions. Oh my God, this is complicated, and it's confusing. I think the way of thinking about sexual dysfunction as primarily an anxiety disorders, translated by the person's individual development into a sexual dysfunction that manifests itself in adolescence and adulthood, gives us again the way to track it, the way to understand it, and the possibility of diagnosing it accurately and therefore providing a therapeutic intervention that has some ability to work. These are, without question, in my opinion as a clinician, the hardest things to treat because they go so deeply and so directly to the core of the child's identity, and they get laid down in the earliest parts of the baby's development and interaction with the mother. Problems don't get any more fundamental than this. And these always have to be handled with kid gloves, slowly, carefully, over the course of significant therapeutic time. If someone comes in to my office and they have a significant sexual dysfunction, I take a deep breath and I try to help them understand that we're in for a long and difficult and sometimes painful bit of anthropology through the depths of their psyche. It's going to be long and hard work to get at this stuff because it is two sides of the same coin, their sexuality and their identity. Okay. Switching over to perversions. If there is a way to distinguish these things meaningfully, it seems that we might fairly follow the great psychoanalytic researcher Robert Stoller, who wrote a book called Perversion, the Erotic Form of Hatred. And I think that sentence right there sets us up with the way to understand something profoundly important, that perversion, what we would now call, again, paraphilia, has at its core not a focus on sex, not a focus on the act of sexual arousal or sexual functioning behaviorally. This isn't about where your penis goes or what goes in your vagina. This is about fundamentally an object relational fantasy at what might be a level of pre-self structure. That this could be a part-object dynamic where in the child, in the infant's mind, part objects are trying to coalesce into an identity. And love and hate are in the mix. And aggression and hostility are taken in more than love and care and empathy. And I think if ever it was valid, that old Native American saying is true here. There are two wolves in every man's heart, love and hate. Which one wins? The one you feed the most. And in the case of paraphilias and perversions of the worst sort, one finds consistently childhoods filled with hate, filled with hate tied to sexual functioning in some quite perverse way. The list is short and horrible and evokes in us revulsion. The first is pedophilia, the focus of an adult on sexualization of children. Sadomasochism, masochistic sexualization enacted through the infliction of pain on the self. Sadistic perversion, the erotic charge in the face of inflicting pain on others. Fetishism, the idea that you can attach sexuality to an inanimate object and avoid the danger, hatred, difficulties surrounding the object relational development of healthy sexuality by projecting that danger, that hatred onto an object and pretending it's got phallic significance. Frotcherism, an odd word, rubbing up against people and getting in a sexual charge by that. Flashers, exhibitionists, voyeurs, those who expose themselves, flashers often. And I would add rapists, necrophilia, those who get sexual stimulation out of touching or being involved with the dead, and bestiality, those who have sexual contact with animals. There is something in all of these categories, the latter only tangentially connected to the DSM-5, the others fully listed. There's something about these that inevitably have that element of hatred, the erotic form of hatred. Hatred is eroticized and displaced onto a part object. The partner is not really a human being, but they're a piece, a part. Their pain evokes the idea of control or power, which has been associated with sexual gratification. And all the rest of these, I think I don't need to go through the details of these. I allow please help yourself. But I think that idea that they've been attached to hatred in the child's development is the consistent theme here. Now, how do you distinguish between anxiety and hatred? It inevitably is a spectrum, and there's a gray area in the middle. I'll grant anyone that. That seems true. That you can have extreme sexual dysfunction that seems awfully perverse, and you can have a paraphilia that on the mild version seems a little more than a dysfunction. Okay, granted. But I think those two ideas allow us to make sense of these things in the context of our clinical work with patients, and every once in a while inside our own experience. I think that's all I need to say about that now. My hope here is that this discussion of sexuality will put a bit of a capstone on the object relational idea. My hope is that we can integrate the DSM's sort of cognitive behaviorist approach to sexuality. The dysfunctions and the paraphilias are described in terms of behaviors. They're described in terms of a checklist of things that are done and some things that are described by the person in ways that look like behavioral checklists. And so the focus is on the externals in most of these situations. But I think that does a disservice to human experience, certainly human sexual experience. If we can integrate these two things, and that's my goal here, building a better model of the human mind, instead of separating them out and only thinking of psychoanalytic ideas, instead of excluding psychoanalysis or excluding the behaviorist, cognitive, descriptive model of mind and sexuality, perhaps if we can use the way these two methods or theories, maybe if we can use both of them, we can have a bigger piece of human sexuality. My fantasy is they are really two sides of the same coin. They're two elements of human experience, and we shouldn't exclude either of them. I do think that without an understanding of the meaning of these behaviors, we have no chance of fixing any of these problems. And they are problems that are becoming more and more severe. I don't know any therapist who won't say over the last 10, 15, 20 years, we're seeing more and more severe pathology as things seem to unravel in our families, as things seem to unravel in our culture. The level of pathology therapists are dealing with seem to be increasing. Nancy McWilliam, the great psychologist who's penned some of the best treatments of psychopathology, once quipped, we're raising an entire nation of sociopaths. And I think she said that not tongue-in-cheek, but sort of as a warning and a sort of a horror. Oh my God, what are we doing? My sense is it's more important than ever that we get a handle and come to some theoretical understanding of sexuality. It will not do to stay rigid and moral and narrow-minded about the scope and power of sexuality. It is 1,000 times broader than the old Victorians or the modern religious conservatives think it is. I'm sorry, but that's true. But it is also not the entirely plastic social constructivist delusion that the very disturbed folks on the right, let's call it the radical left, the social constructivists, the activists, it's also a delusion to think that these are nothing more than lifestyle choices which we have to affirm with our sex-positive attitude. These, if you are going down these roads, you are either hideously dangerous to yourself or others, you are committing crimes and abusing others and perhaps yourself in ways that cannot result in anything other than pain and disaster for everyone. At the best case, what you're doing are dysfunctions, which means it doesn't work, and that some understanding of what's going on and some open awareness that it in fact doesn't work and it has meaning underneath it which we can get at might move any of these folks into a more joyous, loving, respectful, and that's what we're talking about here. There is a kind of respect in recognizing the boundaries of reality, in recognizing the boundaries of human nature, expanding on the narrow boundaries of ideology, but recognizing the boundaries of, for example, the Oedipus complex, and the fact that attempting to go beyond that is a delusional symptom of immaturity, and that this way of thinking, combining the DSM and the psychoanalytic perspective, might provide us with the tools to help all of us lead better, richer, more productive lives of the highest quality of sexual functioning. And with any luck at all, pass that on to our children. That's the hope. I hope you enjoy this and make some use of it. And I guess that's my final word. This, I hope, is useful. I'm certainly not claiming that it's any absolute truth. So good luck and go out and have some fun with it. Thank you very much.